Welcome to Lecto. Today we are going to discuss potassium-sparing diuretics. In this lecture, we will discuss its mechanism, therapeutic uses, and the adverse effect. So, potassium-sparing diuretics has important features. It actually conserves the potassium that is being secreted in the urine. So, this is the important features. And we categorize the potassium-sparing diuretics into two: aldosterone antagonist and the sodium channel blocker. Spironolactone and eplerenone is categorized in the aldosterone antagonist, and the triamterene and amiloride is categorized in the sodium channel blocker. So, first of all, we will discuss its mechanism. So, here you can see this is the structures of the nephron. First part is the glomerulus, at which a blood filter, and next is the Bowman's capsule, and here is the tubular region. Proximal convoluted tubule, this is the loop of Henle, and this is the distal convoluted tubule, and last is the collecting duct. This is the collecting duct. So these are basically the different components of the nephrons, but our main focus is on the late distal convoluted tubule and the collecting duct. In the late distal convoluted tubule and the collecting duct, you see the two important cells, principal cells and the intercalated cells. So here you can see this is the principal cell and this is for the intercalated cells. Okay, these are basically the two cells. First of all, we will discuss the normal mechanism in the principal cell and in the intercalated cell. Then we will discuss how potassium-sparing diuretics affect on these cells. So, here first of all, you see that the sodium that is filtered from the glomerulus move through the tubule and ultimately reach in the collecting duct. Okay. Now, the sodium that is present in the collecting duct move into the cell through the sodium channel. This is actually the sodium channel through which the sodium move inward. This is the case. Okay. Now the sodium that is now present in the cell move into the first interstitial space, then finally into the blood vessel. So in that situation, the sodium will move through the ATP pump, sodium potassium ATP pump, that is most important pump in our body. So in that situation, the sodium move in the interstitial space, and the potassium that is present in the interstitial space move inside the cell. Here is the potassium. This is the case. Now what will happen? In that situation, sodium move inside the blood vessels, and now when the potassium move in the cell, then the concentration of the potassium in the interstitial space is reduced. Then automatically the potassium will move from the blood vessel into the interstitial space through the diffusion. So this is the case. Now the sodium is ultimately reached in the blood vessel, and in exchange for that, the potassium excrete or exit from the blood vessel. Now this potassium will move outward and release in the collecting tubule, and ultimately it excretes from the body. So this is actually the normal mechanism in the principal cell. Okay, now this sodium channel is controlled by a special mechanism. So actually there is a receptor. Here is the receptor which is present in the principal cell. Okay, now this receptor is actually the aldosterone receptor. This receptor binds the aldosterone. Aldosterone is actually present in the blood. Now the aldosterone move into the interstitial space and then bind to the aldosterone receptor. Now this is actually a complex. This is a complex between the aldosterone and the receptor. Now this complex that is formed inside the cell move in the nucleus. Here is actually the nucleus, and nucleus has DNA. Now, what will happen? The aldosterone receptor complex move inside the nucleus, and it help in the translation and the transcription. So here is the situation. Now this complex will move inside the nucleus, and this complex help in two processes. Translation help in two processes: translation and transcription. These are basically the two processes through which you will see that the DNA ultimately convert into the protein. So through the translation and transcription process, DNA can form the protein. So in that situation, the protein now present in the cytoplasm. Okay, now this protein that is formed through this process, translation and transcription, move towards the sodium channel and ultimately activate the sodium channel. So as a result, sodium moves inside the cell, and exchange for that potassium move outward. So this is actually the normal mechanism. So next we will discuss intercalated cell, and finally we will discuss the effect of the potassium sparing diuretics. So in the intercalated cell, what will happen? Here you can see the potassium that is now present in the collecting duct. Here the potassium will exchange for the hydrogen. In that situation, this potassium will move inward. In exchange for that, the hydrogen ion will move outward. So where does this hydrogen ion comes from? So there is a mechanism. Here you can see the carbon dioxide present in the blood vessel. Now this carbon dioxide move inside the cell. So here is the carbon dioxide, and it will combine with the water, and as a result you will see the formation of the H2CO3 carbonic acid. Carbonic acid is formed. Now carbonic acid dissociate into the ions, which is the HCO3 negative plus H positive ion. So as a result of the dissociation of the carbonic ion, you see the two important signs: bicarbonate ion and the hydrogen ion. Now this hydrogen ion actually move outward through the potassium and the hydrogen exchanger. Now, and another important thing, this hydrogen ion can move through the another ATP pump. So this is an important pathway. So hydrogen ion can move in the collecting duct through two pathway. It can move through the potassium hydrogen exchanger and the ATP pump. So these are basically the two pathways. Now here is the situation. This potassium that is moved inside the cell now move here and ultimately reach in the blood vessel through the channel. So this is the case. And important thing is that here is the situation. Now this bicarbonate ion that is present in the cell move again back into the blood through, here is the channel that through which the bicarbonate ion move in the blood vessel, and in exchange for that you will see the chloride ion move inside the cell. Okay, now this chloride ion move ultimately outward through another channel, which is the chloride channel. These are basically the different pathway that happens actually in the intercalated cells. So now we actually categorize the potassium sparing diuretics into two. First one is the aldosterone antagonist. This is the case one. And second, we divide it into sodium channel blocker. So as the name indicates, it actually goes against the aldosterone. Now what will happen when we take the aldosterone antagonist, in which you will see two things: spironolactone and the eplerenone. two drugs actually categorized in the aldosterone antagonist. So now here is the, let's for if I say this is the spironolactone, and this spironolactone binds with the receptor. Now there is a competition between the spironolactone and the aldosterone. Aldosterone says that he will bind to the receptor. Spironolactone says that he will bind to the receptor. Now there is a competition between the spironolactone and the aldosterone. So in that situation, those substances will dominate whose concentration will be high. So in that situation, if we take the spironolactone in high concentration, then spironolactone prefer to bind with the receptor. So in that situation, this process will stop, in which translation and transcription stop, and ultimately protein will not form, and in that situation, this channel will be blocked. Sodium channel will be blocked. So this is the situation. Now, if we take spironolactone combined with the receptor, and it actually broke the transcription, translation, and ultimately protein is not formed. And this protein, if the protein not formed, then sodium channel will not activate. In that situation, sodium will not be able to move inside the cell. So in that situation, potassium will also unable to move outward. So now these two both channel, sodium is directly blocked and potassium is indirectly blocked. So in that situation, what will happen? Sodium will retain inside the tubule, okay. Now, and the potassium will retain inside the cell. So in that situation, potassium that comes from the blood vessel concentration high. So in that situation, the potassium in the blood is reserved. So that's why we call the potassium sparing diuretic. This is the case of aldosterone antagonist. Okay. Now another thing is the sodium channel blocker. In that situation, we categorize amiloride and triamterene. In that situation, these drugs actually, here is the situation. These are basically the sodium channel blocker. In that situation, these drugs move and ultimately directly block the sodium channel. If the sodium channel block, then the sodium will not move inside, and exchange for that, potassium will not move in the collecting duct. So in that situation, whole process is stopped. So this is actually the direct process, and this is actually the spironolactone is actually the indirect process. So this is actually the mechanism how potassium sparing diuretics work and conserve the potassium in the body. So next we will discuss the therapeutic uses. First of all, we will see there are two situations in which we see the aldosterone increase. Now there is a competition between the aldosterone and aldosterone antagonist. So this competition you have to remember. Okay. Now there are some condition in which the aldosterone level increase in the body. So what condition? In hepatic cirrhosis and the nephrotic syndrome. In the nephrotic syndrome. In these conditions, you will see the hyperaldosteronism, in which the aldosterone concentration will increase. So this is the situation in which aldosterone concentration increase. Now what will happen? Aldosterone actually activate the sodium channel. So in that situation, more sodium move inward and more potassium will loss. So in that situation, you will see the sodium increase in the blood. So this is the situation. Now if the sodium move inside the blood, then the water will prefer to retain inside the blood. So this is the situation. Now actually there are different aquapores that are present in these cells. Now the water will move inside the blood. This is the situation. So there is a simple rule. When there is a solute, then ultimately afterward you will see the water will also move towards the solute. So this is the basic concept. Okay. Now in that situation you will see the condition in which the water also water concentration are also increase in the blood. So in that situation you will see a condition which is called the ascites. Now in that situation you will see what is ascites in the peritoneum cavity. You can say peritoneal cavity. You will see the fluid accumulate in the peritoneal cavity and the abdomen become enlarged. So in that situation, this is the condition in hepatic cirrhosis and nephrotic syndrome. You will see the aldosterone increase, sodium that actually increase the amount of the sodium in the blood. In exchange for that, water concentration will also increase. Now the body fluid has been increased. In that situation, this fluid will accumulate in the abdomen or peritoneal cavity, which causes the ascites. Now, if we use the spironolactone, or you can say eplerenone, these are actually the aldosterone antagonists. Now, if we take the aldosterone antagonist, here is the situation. Now, there is a competition. If we take the aldosterone antagonist, now in high dose, then what will happen? The aldosterone antagonist bind to the receptor and block all this process. So in that situation, sodium will not be able to move inside the blood. So ultimately, you will see after taking the aldosterone antagonist, so in that situation, the condition become reverse. Sodium concentration reduce in the blood. Ultimately, water will also reduce, and ultimately the ascites become reduced, in which you will see the fluid in the peritoneal cavity will become reduced. So this is the case. Now, second use of these potassium sparing diuretics in the cardiac remodeling. So here is the situation in the cardiac remodeling. What is cardiac remodeling? Cardiac remodeling is actually different changes in the heart functions and the heart structure, like cardiomegaly, increase in the size of the heart, and you can say heart failure. So in which you will see the functionality. So in that situation, there are some situations that the aldosterone, if the concentration of aldosterone increase in the body, then it causes the cardiac remodeling, like the cardiomegaly and the cardiac failure. So in that situation, if someone wants to treat the cardiac remodeling, then we should decrease the concentration of the aldosterone, which is the primary cause of the cardiac remodeling. So in that situation, if we take the aldosterone antagonist, then ultimately what will happen? The concentration of the aldosterone will decrease, and ultimately it help in the treatment of the cardiac remodeling. So this is the situation that how potassium sparing diuretics help in the treatment of the cardiac remodeling. So this is the situation. Okay. Now next situation, it also used in the treatment of the polycystic ovary syndrome, and this is called the polycystic ovary syndrome, PCOS. Now here you see that aldosterone antagonists include two things. First one is the spironolactone, and second one is the eplerenone. These two drugs. Actually, you see their primary function is actually with the binding of the receptor, aldosterone receptor. This is their primary function. Now, you see that eplerenone is actually more selective. This is actually the more selective than the spironolactone. This is less selective. What is mean by more selective and less selective? You see, eplerenone specifically bind to this receptor in the body. Now, spironolactone also bind to the aldosterone receptor, but there is another situation. It also bind to the androgen receptor. So this is the situation. Now it also bind to the androgen receptor. And if the spironolactone bind to the androgen receptor, then the concentration of the androgen will reduce. In the polycystic syndrome, we see that you will see the increase in the concentration of the androgen. Androgen concentration increase in the polycystic ovary syndrome. Now, in that situation, we have to reduce the concentration of the androgen hormone. Now, if we use the spironolactone actually help in the reduction of the androgen hormone level. So, this is actually spironolactone used in the treatment of the polycystic syndrome. Now, you see that the spironolactone basic function is used in the potassium-sparing diuretics. It acts as a potassium-sparing diuretic. But in that situation, it is used for another purpose. It is used for the reduction in the androgen hormone. Now, on the basis of this, we call it off-label. Actually, off-label are those drugs that are used instead of its primary function. So this is actually the off-label drugs, which is the spironolactone. Okay. Next is the resistant hypertension. Resistant hypertension actually high increase in the blood pressure. In that situation, you will see blood pressure will remain increased even though we are using 3 or more drugs, 3 or more anti-hypertensive drugs. So, what is mean by resistant hypertension? That hypertension or that high blood pressure in which we take 3 or more anti-hypertensive drugs, but even its usage, the blood pressure is not become normalized. So this is the resistant hypertension. Then what should we do? So in that situation, we use the potassium-sparing diuretics. Potassium-sparing diuretics actually increase the volume of the urine and decrease the volume of the blood. So if the blood volume, so in that situation, this is the case, potassium-sparing diuretics actually decrease the blood volume and you will see the urine volume increase. So now urine volume increase and blood volume decrease. If the blood volume decrease, then ultimately you will see the blood pressure will decrease. So this is the case. Now resistant hypertension will become or move towards the normal if the blood volume decrease, then blood pressure will also be decreased. So this is the situation. Next is the adverse effects. As we see that spironolactone, specifically spironolactone is actually the less selective drug. It binds to the aldosterone receptors and the androgen receptor. And what will happen when it binds to the androgen receptor? Androgen, if I take the example of the androgen like testosterone. If the spironolactone binds to the testosterone receptor, or you can say androgen receptor, then the concentration of the testosterone, or you can say androgen, will reduce. So this is the situation. In that situation, the concentration will reduce if the spironolactone bind to the androgen receptor. So in that situation, when the testosterone level in the decrease in the male, then you will see the enlargement of the breast in case of male. So this situation is actually called the gynecomastia. So this is the situation. By the usage of the spironolactone, the male breast enlarged. So this is the called the gynecomastia. And if we stop the treatment, or if we stop taking spironolactone, then the condition will move towards the normal. So this is the situation. And last adverse effect is the hyperkalemia, high potassium level in the body. As we know that they actually conserve or increase the concentration of the potassium in the blood. When we also take the potassium supplement along with the potassium sparing diuretics, now it causes the hyperkalemia. So we do not take the potassium sparing diuretics along with the potassium supplement. So this is actually the different adverse effect of the potassium sparing diuretics. So this is all about the potassium sparing diuretics. If you have any question, then you may ask in the comment section. Thank you.